Hi, this is Dave here from ProSport Physiotherapy, and in today's video I just want to go through some of the common symptoms that we might see in the clinic, usually with shoulder pain. Okay, and just give you an insight into what your symptoms may mean or what they may not mean. So the shoulder is a little bit complex because there's quite a lot of bones kind of interacting, and the first bone obviously is your humerus. So this is this kind of bone here. Then we got a collarbone that comes across our chest and actually joins to form a part of that shoulder complex. And then we've got your shoulder blade that has this kind of spine of the scapula, it's called, and that just comes right over. And there's a little ridge here that the humerus sits under. Okay. Then we've got all our biceps tendons, or long-headed biceps tendon comes up here, and then it joins into the capsule. And we've got our rotator cuff muscles that, traditionally you'd see people doing those exercises. Your infraspinatus, your teres minor, and then your supraspinatus will pop around into the front there. So there are your rotator cuff tendons. Then we've got some important ligaments. We've got our AC ligament, or acromioclavicular ligament. Okay, that's pretty important. We're going to go and discuss that in a sec. And then you got your coracoacromial ligament here and your trapezoid ligament in the front there. And then that whole shoulder is surrounded by a capsule. Okay, so there's a labrum in there that just allows that ball and socket joint to sit nicely. And then there's that ligamentous kind of structure then around it, just to really keep it nice and cozy and stable. Now, the first thing that I would like to say is it doesn't really matter what your scan has shown in terms of impingement or bursitis or anything like that, because there's a lot of people walking around absolutely pain-free, and the research has shown is that when we scan their shoulders, a lot of those people are showing signs of bursitis. Some people have even partial rotator cuff tears that they didn't even know about. Okay. And there's wear and tear around the shoulder. Again, wear and tear is very normal. It's a part of going through life, and it doesn't necessarily mean that we have to have pain with wear and tear. Okay, so the big thing to understand with the shoulder is that we just need the muscles around the shoulder to work very, very well together. We need the ligaments to be communicating with the brain and allowing forces to transmit through them well, and we also need the capsule and the labrum also to be doing their jobs. Now, very often we can have what's called a impingement, where as that humerus comes up, one of the rotator cuff muscles, okay, or the common tendon can just get a little bit pinched. Okay, that can kind of have pain, about usually this painful arc of about 90 degrees, and then it kind of tends to go after that. Now, there could be many causes for that, and we can't really say, okay, it's because of your shoulder blade isn't moving well, or this isn't moving well. The actual cause of the injury is very, very specific to you. So your body has set itself up now, maybe due to your work situation, maybe you're playing a sport that involves using your hands, maybe you work with a lot of stuff overhead. Your body has set itself up for you to be successful at particular movements that you probably do a lot during the day, and that can maybe include how you sleep. So what tends to happen is some of the motor units of particular muscles, then they tend to get inhibited. Okay, so a lot of those fibers, then they can't generate enough tension, okay, in particular movements, and tend to work well together. Now, if you do a lot of something, okay, or your threshold just goes up a little bit, so the load actually just starts to exceed the threshold. So this is maybe your threshold for pain, and then you start to put this shoulder under a bit of pressure, and then you pass that. Usually we get this messengers from the tissues called nociceptors, and then they can send signals up to the brain and go, hey, this guy's putting me under a lot of load here. Okay, so the brain then will take that information and it'll make a call on it. Okay, and 9 times out of 10 the brain will go, okay, relax, he's just painting, or she's just on her mouse and work, and that's absolutely fine. But then once those messengers start to give that signal up and up and up, it's like almost, I like to liken it to my 2-year-old, where once she makes a little whinging or crying sound for a little bit, you're okay with that. And then as the day goes on, you're minding her for the full day, and then by the end of the day, you hear that sound again, and you're a little bit sensitive to it. So it's starting to annoy you a bit now. And that's what happens, I think, as well with the nociceptors, is they keep sending the message up to the brain. the brain goes, okay, I'm absolutely sick of you talking to me about this. So then what it does is it sends this pain. Okay, so pain's actually an output of the brain. So the brain decides when to have pain. Okay, and that's important, that just because you have wear and tear in the shoulder, it doesn't necessarily mean that the damage there, okay, that's shown on the scans is actually the cause of this pain. It may be just that you're putting it under certain pressures. Some of the motor units now aren't firing as well as they should, so they can't create enough tension when you go to grab something, you know, when you change gears in the car or something like that. And then all of a sudden then other muscles tend to work a little bit more. These nociceptors get a little bit grumbly, they send messages up to the brain, and then the brain has this kind of painful output then, so it stops you from doing certain things. And that's what pain is ultimately designed to do. It's designed for you to take action and change something. Okay, so as I said, if you've got, you know, wear and tear, you've got labral tears, okay, your scanners show that, you've got clicky shoulders, that doesn't necessarily mean this is the cause of the pain, because you may have had all those issues for a long time and you didn't even know about it. Just like a lot of people out there are living pain-free, they don't have any pain in their shoulders, yet when we scan their shoulders, we actually see a lot of issues there where you're like, well, why don't they have pain? Okay, so X doesn't always equal Y, okay? And as I said, there's a lot of factors that goes into actually feeling pain, and it's not just a case of the tissue. And that's where we can look at your story, we can look at your history and go, okay, well, why is John or Jane or whoever it is, why is their subconscious giving this pain output? And then we can track that back to your injury history, to some areas where the motor units recruitment may just be altered a little bit, where your body has lost that awareness of those muscles and it can't generate tension quickly enough now. Okay, and the timing gets altered, and the direction of the forces that go through the shoulder gets a little bit altered. We can then go about changing that recruitment order. We can give you back the awareness, we can give you back the ability to generate tension through those motor units, and then very often then, once they do their job, the tissues that were doing even more work as a result of that to compensate for that, then the nociceptors that are in those tissues then will stop sending as strong a signal, so then the brain won't have to react all the time with pain. So that's kind of how we change your pain state without actually changing too much in the structure. Now, hands-on treatment is very, very useful for that. Okay, where we can help the fascia, the skin, just to mobilize short term, just to give the brain some common, you know, information that maybe it wasn't getting because you weren't loading those particular tissues, and we can reinforce that with some exercises very specific to you. Okay, so whether you have impingement, whether you have bursitis, which is just the bursa under hair, that can't mean 100%. We can't say for certain that that's causing your pain. Okay, so we'd be more interested in ProSport physiotherapy is to understanding why the tissues are sending the pain signal, okay, or they're sending that message up to the brain, which the brain is interpreting it as danger, or it's interpreting it as needing to change and take action. Okay, so I hope that was useful. I hope it kind of makes you think twice about, you know, oh, I've got this labral tear, or I've got this rotator cuff tear, I've got this bursitis. A lot of people and a lot of rugby players, especially rugby league, rugby union players, are playing professional sport, they're training every day, they're lifting weights, and we know they have labral tears in their shoulder and they're absolutely pain-free. Okay, and as I said, short term, we just settle it down, we settle the symptoms, we find the cause of it by generating tension through particular motor units. We modify some lifts, we maybe correct some technique that may be predisposed these nociceptors to get a little bit grumbly. Okay, as I said, we do this every day with professional athletes and also with non-sporting athletes as well. So if you've got shoulder pain and you'd like an assessment, then, you know, please feel free to get in touch, or if you have any questions about your particular shoulder pain as well, then please feel free to get in touch.